Hello everyone. The video today is about treating chronic Lyme disease. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So I posted a video some time ago called Case Example Successful Lyme Disease Treatment, where I talk about the successful treatment of a case of Lyme disease in my practice. And somebody posted a question on that video. So it says, this story is exactly what happened to me as far as treatment of antibiotics and the response from my primary care doctor, which I took for 8 weeks after a known tick bite. I have been sick every day for 1 year. My difference is that I have severe muscle loss and weakness along with soft tissue damage throughout. Any suggestions would be appreciated at this time. Thanks. So yeah, I'm sorry to hear that you're going through that, and yeah, it's just really really disappointing and unfortunate when antibiotics don't successfully treat Lyme, because in many cases they do, but in some cases they don't, depending on the research literature that you read. Somewhere between 10% and 20% of cases just either don't respond to the antibiotics, or there's only a partial response, and you wind up with what they call post-Lyme disease syndrome. But then some folks would say, well, it's more like a chronic Lyme or persistent borreliosis picture. But regardless of what the label is, it just really stinks when that applies to you. So I'm sorry to hear about that. So I thought that I would just post a video about sort of the approach that I take to persistent borreliosis or post-Lyme disease syndrome in general, because I think it would be interesting to folks to hear this, hopefully. So, and then this person and specifically anyways, I hope. So generally speaking, when I have patients in my practice and they've been suffering for a year, 2 years, 5 years, 10 years, 15 years, whatever it happens to be, whether they had received antibiotic therapy or not. Generally, when they have a history of where we're very confident that there was a borreliosis issue afoot, then the question in my mind is, well, do they still have the infection, or do they have the lingering effects of that infection in their system? Do they have sort of this post-Lyme inflammatory syndrome, so to speak? And there's research literature supporting the possibility that either or both of those situations might exist. But what it comes down to is, well, what does the research literature say, and then what do we actually see working in clinical practice? So in a lot of analogous cases, what I found to be helpful, and sometimes very, very helpful, sometimes curative, is putting patients on broad spectrum systemic antimicrobial herbs. In some clinics, they would use different pharmaceutical agents, like basically something that's going to kill the bugs. So whether it's antibiotics, whether it's herbs, whether it's antiparasitics, antivirals, some type of an antimicrobial agent or agents, in my experience, tends to be very important. In my practice, I use herbal therapy, and I find that for chronic cases seems to work very, very well in many cases. But again, other clinicians take different approaches. But as I've talked about in some other videos, I'm a very big fan of using what is sometimes called the Buhner protocol. So Stephen Buhner is a herbalist. He passed away within the last few years. Really brilliant guy, wrote these amazing books about Lyme and co-infections, and also wrote about the herbal treatment of those conditions. And so those are the herbs that I tend to focus on the most. I won't get into those herbs now because there's only so much time in the video, but please cross-reference those other videos if you go on my YouTube channel and just plug in, I don't know, something like Dr. Raid, herbal treatment Lyme or something like that. Video should come up. So working with those herbs at a fairly robust dose tends to be a cornerstone of what I recommend for my patients. I tend to recommend them in an herbal tincture form, so an alcohol-based extract. I just find those tend to work a lot better than powdered herbs, whether they're just straight powders or they're encapsulated. Definitely better than teas, and I don't know how else you would take an herb necessarily, but anyways, tinctures tend to work the best. For some patients, they can't consume alcohol, and so we work with herbal powder alternatives, but it generally works the best in a tincture form. What's also really important in the majority of cases that I work with is making sure that we're supporting the overall physiology of the patient in question. So if they come in and they've got these chronic Lyme symptoms, but they've also got a lot of fatigue, which is a very, very common feature of patients with persistent borreliosis. Oftentimes I'll recommend that they go on mitochondrial support. Also have videos out there about the comprehensive treatment of mitochondrial dysfunction, how to support the mitochondria, the little energy producing units in the cells. So I use a product called Mitochondrial Support Formula. I have an entire video about, what's in that, and so anyways, that's another video you can check out if you want, and then that's typically coupled with a high potency multi-nutrient, which I also talk about in other videos, but the one that I like is from this company called NFH, which is Nutritional Fundamentals of Health. They're a Canadian company, and they make a really great product called Multi-SAP. I have no financial interest in that company, it's just the one that I like the best. There's other good ones out there, they're really well priced, and it's a great formula. So excuse me. So if a patient's having a lot of fatigue, I'll bring mitochondrial support into the mix. If they're having a lot of pain issues, then I might work with things like PEA, or if there's a lot of nerve pain, we might use intravenous lidocaine if that is available for that patient. Sometimes we'll use proteolytic enzymes like stratiopeptidase or nattokinase to help with pain issues in some cases. Sometimes the pain that they're experiencing is joint pain, and if it's, one or two or three or four major joints, we might do ozone injections into those joints to help reduce the pain and inflammation, help to promote tissue healing. So symptom management is important as well, not just for the patient to feel more comfortable, which is a big motivator for symptom management, but also because it's really important, in my opinion, to try to reduce symptoms, because then the patient's going to have more physiological reserve to actually kick the infection to the curb. Some patients and some clinicians kind of, turn their noses up a little bit at symptom management, thinking I want to get to the root cause. Like, I do too, believe me. Root cause, treating the root cause, it's why I get up in the morning, treating the root causes in my practice. However, if a patient is really tired and suffering from a lot of pain, and it's going to take a lot longer for those herbs or those antibiotics to work well in many cases, if we aren't doing something to help try to boost up their cellular energy, reducing the pain, the inflammation, the things that are kind of dragging them down. So treating any symptoms as best we can while we're waiting for the antimicrobials to do their thing is oftentimes very important. The other thing that I always have on my radar when I'm dealing with any type of a chronic infection patient is low-dose immunotherapy. I have, or LDI for short. I have other videos about that as well, but in a nutshell, if a patient has this post-infectious inflammatory issue going on, then low-dose immunotherapy is hands down, in my experience, the most effective way to immunomodulate the immune system back into a nice balanced non-inflammatory mode or less inflammatory mode. So for patients who have been through a lot of antimicrobial therapy, whether it's pharmaceutical or non-pharmaceutical, and they're still having symptoms, or maybe they've never got better at all in the first place, low-dose immunotherapy can be really, really helpful. So the antigens for Borrelia, Bartonella, Babesia, Mycoplasma, Strep, yeast, those tend to be the heaviest hitting ones, the ones that are most consistently helpful and successful for patients. And there's other formulas out there that are sometimes helpful too, but those are the ones that are the most commonly helpful. There are other adjunctive things that we might use, like different intravenous therapies, like IV nutrients, like a Myers cocktail, to help try to get the energy levels up faster, or we do a lot of intravenous ozone therapy in our practice because it's antimicrobial, anti-inflammatory, immunomodulating, promotes tissue healing. It's good for the mitochondria, it's just good for everything. So that those are adjunctive therapies that we can use, but it's really quite rare in my experience that a patient would need IV therapies to get better in persistent borreliosis or post-Lyme disease syndrome case. I look at IV therapies as being an accelerator pedal to help them get to the finish line faster, but not typically a mandatory thing that's needed, but they can be really helpful. So I think that's most of what I wanted to convey in this video. I hope that was the type of information that is useful and helpful for the person asking the question. As per always, I can't talk about dosages and things like that or specific recommendations in my videos, and quite frankly, it's just so nuanced and varied. There's not really like a one-size-fits-all by any stretch of the imagination. You really need to ideally work with a clinician who knows what they're talking about, who's Lyme literate, as they say, and get some detailed or personalized advice. So anyways, I will leave it there for now. If anybody has any questions or comments on this video or anything else, please just post in the comment section below, and I will do my best to answer as soon as I can.